Hello and welcome to my page Against All Odds. Sorry, I have to call a quick timeout here. I actually wanted to tell you our story or what I experienced just from memory, but now I took a look into my book. Yes, it's better if I use my book as a guide because I've experienced so much and I couldn't remember all the details. I've now gone through the book again, and yes, it's really incredible what I unfortunately had to go through or what my darling unfortunately had to endure. I'll start at the point when Julia was admitted to the Horst Schmidt Clinic in Wiesbaden. Here I was given direct diagnoses. Only 1 in 1,000 survives an accident like this. And if Julia were to survive this accident, the brain injuries are so severe, she will never regain consciousness. The occipital bone had broken out at the back of her head. In other words, back here where the spine enters the skull, it was broken on both sides. In addition, she had a skull base fracture that went through the right ear canal. That's why Julia wears a hearing aid today. She had 2 cerebral infarctions, injuries to the brainstem and to the frontal lobes. She had brain hemorrhages. A fistula formed as a result of the brain hemorrhages. I'll explain what the fistula is in more detail later. Yes, the pain my sweetheart endured must have been unimaginable. Julia was also immediately placed in an induced coma. This coma was maintained for 7 weeks. 7 weeks in an induced coma is a very long time. During this time, they tried to relieve the strain on Julia's body, or rather, the medications Julia received because of the coma naturally put a strain on her body. To briefly relieve her body, they decided on an anesthesia procedure that's used in anesthesiology, but actually not during the stage or phase Julia was in. It was called Anaconda. That means Julia received anesthetic gas for a period of time. Yes, Julia also lost an incredible amount of blood in the accident. And during the time Julia was in a coma, she also had a fever, meaning an elevated body temperature. Here, Julia was also given blood transfusions to help her body, or rather, to lower her body temperature. Yes, my darling was 7 weeks pregnant. What does our unborn child already have to endure? Right now, I want to talk about the fistula again. Julia had brain hemorrhages in the accident. It was during these brain hemorrhages that the fistula formed. In other words, an artery found a connection to a vein. At first, this actually saved Julia's life because she didn't die from the brain hemorrhages. Nevertheless, it was an unnatural connection. As a result, there was always high intracranial pressure. At first, it was unclear why this intracranial pressure was developing. When the brain expands inside our skull is there. That means the brain expands, and at some point it reaches its limit, but it still wants to keep expanding. And here it can happen that the brain gets crushed inside our skull. To prevent this, the skull cap can be opened. This was discussed several times. But the reason for the increased intracranial pressure was still unclear up to that point. At this point, Nurse T gathered the courage to go into the scanner with Julia. That is, at this time, Julia was still on artificial ventilation. Nurse T took a resuscitation bag, went into the scanner with Julia, and provided her with artificial respiration. Now it was discovered why Julia had this intracranial pressure. The fistula was found. This fistula can be removed. The removal of this fistula is called coiling. There are not many doctors in Germany who can perform this procedure. One doctor was at the University of Frankfurt. Julia was flown to Frankfurt by helicopter. The coiling procedure was performed here. In other words, a wire was inserted through Julia's groin, past the heart, up through the neck, and into the head. And here the fistula was plugged. That means the fistula was closed off with a wire. basically like a stopper in a bathtub. Yes, Julia was still monitored at the university hospital here. Then she was transferred back to Wiesbaden. Now I want to tell you about an event that you usually only see in movies. We were in Julia's room. Of course, Julia was hooked up to the ECG, meaning there was a monitor up there. There were the wave lines and the beeping sound, which by now we had gotten used to. And suddenly, beep, a long tone, and the wave lines went flat. It took a moment to actually realize what had just happened. You look at it, wondering what's happening now? At that moment, the doctors were already in the room and asked us to leave as quickly as possible. We were very anxious. We didn't know what was going on. We waited in the waiting area. It felt like an eternity. It was probably only a few minutes. Then we were called back in and told that Julia had suffered a cardiac arrest. Intense, yeah. But her heart started beating again on its own. Julia didn't need to be resuscitated. Everything is okay again now. Yeah, it's pretty intense what we had to go through. What my sweetheart had to endure, Julia was pregnant. Yes, on December 7th in the year 2009, our beloved daughter experienced her very special second first birthday celebration. She hadn't been born yet. On that day, I decided to go through with the pregnancy. The pregnancy was constantly monitored by ultrasound, but no doctor could tell me, Mr. Almoril, your child will be born healthy. But no doctor ever told me, Mr. Almoril, you will have a sick child either. The doctors remained neutral, and there were two sentences I kept hearing. I will never forget them. The first, Mr. Almoril, the child is very active, which is a sign of a healthy pregnancy. And the second statement was, Mr. Almoril, the accident happened at a very early stage of the pregnancy. If the child had been affected, nature would have taken care of it. Yes, and then there was also the statement, if Julia were to survive this accident, she would never regain consciousness. Yes, of course, I wanted to save our love. And on December 7th, 2009, I decided to go through with the pregnancy. December 2009, I decided in favor of the pregnancy. Looking back, it was the right decision. Yes. There was still a long way to go. But for now, I want to stop here, and next time I'll tell you more. Until then,